Hello and welcome back to your therapy guide, the podcast created to help you navigate your therapy journey. I'm Dr. Yadegarfard. In this episode, I'll do my best to explain some of the different approaches to therapy. It's important to know that not all therapy is the same. There are many different schools of thought, and understanding them can help you find a good fit. Therapy is not a one-size-fits-all solution. Think of it like a journey in a new city. You could travel by car, bus, or on foot. Each method has its own pros and cons, and the best choice depends on where you want to go and what you want to see along the way. Therapeutic approaches are similar. There are different methods to help you get to your destination. I want to briefly explain three of the most well-known approaches. First, there is psychodynamic therapy. This approach is rooted in the idea that our past experiences, especially from childhood, deeply influence our current thoughts, feelings, and behaviors. The focus is often on exploring unconscious patterns and unresolved conflicts. The pros of this approach are that it can lead to a very deep, profound understanding of why you are the way you are. The cons are that it is often a long-term process and may not be focused on solving a specific immediate problems. Next, we have person-centered therapy. The core belief here is that you have the inner resources to find your own solutions. The therapist's role is not to give you advice, but to provide a supportive, non-judgmental environment. The pros are that it's incredibly empowering and can help you build self-esteem. The cons are that it might feel unstructured for someone who's looking for very specific tools or strategies. And then there is cognitive behavioral therapy, or CBT. There is an action-oriented approach that focuses on the here and now. The main idea is that our thoughts, emotions, and behaviors are all interconnected. By learning to change our unhelpful thinking patterns and behaviors, we can change how we feel. The pros of CBT are that it's very structured and provides you with concrete, practical tools you can use in your daily life. It can also be a more short-term approach. The cons can be that it may not delve as deeply into the past. My personal approach to therapy is integrative CBT. This means I mainly use CBT because of its effectiveness in giving you practical tools. But I also integrate ideas from other approaches to provide a more tailored treatment for your individual needs. For instance, I might draw from psychodynamic ideas to help you understand a long-lasting pattern, and use person-centered principle to create a safe space for you to discover your own strength. This allows me to adapt my approach to what works best for you. In a future episode, I will talk specifically about the CBT model and how its principles are going to help us in our work together. Thank you for joining me on this episode of your therapy guide. These short episodes are designed to answer some of the most common questions my clients ask, and I encourage you to listen to other episodes to find answers to your questions. Don't forget to subscribe to this podcast and follow me on my social media channels so you don't miss any future episodes. You can find all the links in the show notes. Until next time, take care.